the what would you say are the effects of not treating it in good time?
Yeah, the effects of not treating arthritis in good time,
especially this we're talking about
of juvenile arthritis,
yeah,
is the child will not be able to grow properly, because these are conditions, we call them inflammatory conditions. Now, inflammatory conditions in the body, they will interfere with the growth of the child. Now, growth, development, normal life, a normal child should be able to grow and play normally. That is, even when you are treating juvenile arthritis, what you are aiming at is to get a child who is playing and growing normally. Okay?
Yeah.
So when arthritis is not treated properly, those two will not be there. This child will not be playing, this child will not be growing normally. And then eventually the joint will be deformed. Now, deformity can be such that if it is like I was giving you an example of one knee has arthritis, the other one is normal.
Yes.
The area where there's arthritis, there's more blood flow because of inflammation. So the bone around that area grows faster. So you find that limb becoming longer than the other one.
And deformed.
These are real things. They are real. So this child eventually will be limping. Okay? Limping with one leg longer than the other. If you have that from a lower age, eventually you end up with a tilted pelvis, and you end up with a back problem. And of course, because the other joints are out of line, you will find one is bearing more weight than it was supposed to bear. And this bring complications in future, so that they will be able to develop now degenerative arthritis faster, earlier than they would have done it because of natural aging. So that also will be a kind of like a complication. Then the other thing is, some of these joints, they can get fixed. They get swollen, and they get swollen permanently and fixed in a particular position. A position which the child feels comfortable. A position of least pain, where they don't want to move. So if it was like the elbow joint, normally people find it more painless when it is flexed, folded. When you try straightening it, the patient screams of pain. So you'll find the elbow gets fixed very quickly. Very quickly. Something like maybe 2 weeks, 1 month, you find the elbow. You try taking it out, it's already difficult to take out. So it will be swollen and fixed. This person is not able to take that, to extend that elbow. So various joints, depending on which one now is affected, so you find there's deformities and disability. So you get permanent deformities, permanent disabilities. There's one case I will never forget.
Yes.
A young man of 25 years old was misdiagnosed when he was growing up. So by the time he was reaching us in the clinic, he was on a wheelchair because almost every joint could not move, including the neck. He couldn't move his neck, he couldn't move his knees, he couldn't move his arms, the hips, the ankles. So he was just being carried and put on a wheelchair. He's 25 years old. So that is now who he is. He's fixed. He's to be carried and put in a wheelchair. Something which, if it was diagnosed properly when he was young, those things could have been avoided. Yeah.
So those are like the glaring consequences.
Yeah.
Not
of delayed recognition and diagnosis and referral. The correct referral, referring the patient to the correct place.
It looks like the government has a lot to do in terms of sensitizing
The public, because
Yes.
the majority, everybody when you diagnose a child with arthritis, there is no parent who is not surprised. And sometimes I throw this in when I'm just discussing a patient, discussing with a patient issues of arthritis, and they mention that, but I'm still young. You see, you will find somebody who is 35 years comes to you, he tells you, or she tells you, don't tell me I have arthritis. I thought arthritis was for old age.
Precisely, like
that is said almost on a daily basis. Now, this is the time now I take time to tell these people that arthritis starts from childhood, from age 0 to and above. Yeah, so most of our people still don't even know that a 35-year-old or 25-year-old, 14 years old, 16, 20 can have arthritis. They don't believe it. So it's a huge
it's a huge shock.
It's a huge challenge.
Yeah, challenge
of sensitizing the population to know that actually arthritis can occur at any age. The only thing is which arthritis. Because arthritis, that painful swollen joint, or a joint which is painful with movement, the causes are many.
Yes.
So there are some causes which are found only in aged people due to aging, and others are found because of other reasons, maybe infections, and the most common one is just systemic inflammatory conditions. That's the most common one in young people, and then these ones affect women more than men most of the times. Yeah.
This is very interesting because sometimes you wonder who is to blame, because it looks like the parent has a lot to do for the health care of the child. He has to know. And because there is not much publicity about this information that we are picking today.
Yeah, there is the notion that arthritis is an aging problem.
Yeah, it's.
You see, the moment we get rid of that notion, or the what is misconceived as a problem of aging.
Of aging, yes.
We will be able to tackle the rest together.
Yes.
Because once some people are alerted that arthritis can start from age 0 to and above, then of course when you pass that information, you are also passing the information that children have their own arthritis. Yes, children have their own arthritis. So now that we talked about those joint deformities,
Yes.
and disabilities, okay, and now of course quality of life, health-related quality of life is completely messed up. Yeah, and then again the other causes, complications now like the eye, which we are talking about, may also be affected.
Yeah, just maybe forgive my ignorance. How is it related to polio? Because when I look at polio, it looks like it's a joint disease.
No, polio
But
is
we know more about polio than we know about.
polio is a viral infection, which eventually is actually a neurological problem.
Okay.
Yeah, which eventually, because of the paralysis, it leads to fixed, wasted limbs and fixed joints. But that is not arthritis.
It's not related to
No, it's not a joint problem.
rheumatic diseases.
No.